And today, I'm talking about the prospective decision makers, especially in the region of the Americas, and more specifically in Latin America. And we address one component that is really important, it's key for the region. That's the legal system, and how can we address this issue. I talk about this clash of values. Well, as you know, policymakers have to balance a multiplicity of values when making a decision. Criteria such as safety and effectiveness, cost effectiveness, budget impacts, so scientific considerations, economic considerations, but also social values considerations and the process, or those regarding the process. Was the process transparent? Was the society sufficiently involved during the decision-making process? What about ethical considerations? So this is a value judgment, and the point is if they are making a fair decision. Can we know if it's a fair decision or not? How to balance efficiency and equity? But after making a decision, after balancing this so many values that should be considering during the decision, some individuals could maybe not agree, and sometimes they don't agree. Sometimes they don't agree as a group, and they challenge this decision for appealing process, go to the media, and sometimes an individual patient cannot agree. In this case, a way of challenging the decision is the legal system. So, and then the judge became the person who's going to make the final decision, the final call, and to decide if it's fair or not, and to balance the values, and to make a decision. So the thing is, if this procedure really can lead to a more equitable healthcare system. Of course, this is a part of the democracy system, of democracy society, but the problem when it's become too often and can put in risk the sustainability of a health system. So what about the situation in Latin America? The majority of the countries in their constitutions, they recognize the right to health, which has to be protected by the state. That's really important advance, it's important achievements, establishing public health systems, some based on social security schemes, other based on universal health systems. But despite the achievements regarding this access to health technology, a growing number of patients are going to the courts, to the legal system, and claim to have access for certain technologies that are not provided by state. In the great majority of the cases, courts have been decided in favor of the patients, ordering the state to provide the treatment in the short time, which has had a significant budget impact in some countries on the Ministry of Health. In some countries, I know very well the experience of Brazil, they order to provide in 24 or 48 hours under the risk of imprisonment of the authority. So this is really, really strong. So this process has been called the judicialization of health. And I would like to show you some data to illustrate this discussion. I'm using here data from two very interesting studies, one from the Pan American Health Organization, and the other one from the World Bank Institute. World Bank Institute is also doing a great job in this area. So, and now the two organizations are working in collaboration to address this issue. I can give you more details during the discussion. For example, Brazil, Colombia, and Costa Rica are the three countries that we have more data. As you can see the numbers, the great majority of the decisions favor the claimants, favor the patient. In Brazil, 240,000 federal cases in 2010, that's huge, and $550 million. And in one case, in one very important state, the third state in the country, 79% of the medicines requested had alternatives with similar effectiveness. In Colombia, between 2003 and 2009, the average increase per year of the reimbursement of medicines, not including the benefit package, was 68%. And 2009, litigation cost the public sector $300 million. So this is really a major concern. And as you can see here in the, and this, in 2010, around 150,000 litigations, lawsuits per year. Okay. So what we can do to address this issue is very challenging. The countries, of course, it was not to address only this issue, but it was a very important component of this discussion. Last year, during the Pan American Health Conference, when all the ministers of health gather in Washington, D.C. once a year to discuss the agenda to the main important topics. And for the first time, HTAi was considered a key point to be discussed during this conference. And they approved a resolution, the resolution on HTAi. It was the first, the PAHO resolution was the first one to be approved, adopted by member states in the world, ever. And this is very important. This is consensus. The decision-making process is by consensus during the all member states. So we're saying that all member states in the region of the Americas, I'm not talking now about only Latin America, I'm talking about all the region of the Americas. All member states have considered health technology assessment as essential to support the decision-making process, and the countries should establish decision-making process based on HTAi, should strengthen institutional frameworks and integrate HTAi into public policies on health technologies. And also, they consider that the establishment of transparent decision-making process based on HTAi should help to safeguard the right to health. So there's not any contradiction between looking for guaranteed right to health and this is balance and equity and efficiency. So this is a really very important achievement. Another very important achievement was the creation of the regional network. The working collaboration is key to address the issue of equity and efficiency in the region. The network was created in 2011. We have 25 institutions in 13 countries. And I mention only, I invite you all for a session that we have this afternoon on regional networks. I will give much more details in the presentation this afternoon. But I'll just mention that the main activity that is related to the we're discussing now, it's a mapping of the decision-making process in each of the countries that the members of the network would be a really important opportunity to really know what's going on in each country regarding institutional frameworks to make a decision, regarding the discussion of values and how societies are addressing these values. And also, if they have capacity to really use HTAi to make decisions. I mentioned just briefly a few really recent achievements, and why resolution was so important. For example, in the case of Chile, they just approved the creation of the National HTAi Commission end of 2012, and they mentioned specifically the resolution, the PAHO resolution, as one key point to create the resolution. The two countries that I just mentioned, Colombia and Brazil, that the most affected by this judicialization process. Colombia has just created 2 years ago, but last year really started operation of a new HTAi institute that IETS. They are participating in this conference as well. Brazil approved the National Appraisal Commission established by federal law in 2011, and that's to my last slide is exactly to talk a little bit about the case of Brazil that has really been advancing and progressing in this area. They have HTAi units of Ministry of Health and the regulatory agency. It's this national commission that I just mentioned responsible for making coverage decisions that have to be confirmed that the minister. in 2011, the Federal Congress approved a legislation changing the composition, incorporating members from the civil society, currently a patient representative, and from Federal Physicians Council. So this discussion went to the Parliament, went to the Congress, and the deputies and senators were discussing the importance of HTAi and deadlines, what would be the ideal composition, how to have patients incorporating into the decisions. So this is important because we don't know the answers, we don't have the solutions, but the society is working together to address the issue. And I mentioned one example for our discussion that I think is very controversial, but it's an example how can it's balance, how the society, how the decision makers try to balance the values around decisions, sometimes really difficult decisions. This one is an example. Avastin and Lucentis, bevacizumab and ranibizumab for macular degeneration. They were praised last year, and based on HTAi reports and also budget impact and considerations, the Commission decided to recommend only the first one as this off-label indication. A clinical guideline was produced and submitted to public consultation for 60 days. This is a new process to submit all the clinical guidelines for public consultations. And the public hearing, it's also possible when you have all the stakeholders, all the patient representative, the industry, legal, government, and everybody in the room can discuss and really debate what's going to be the best decisions. Of course, the final call is the Minister of Health, but this is a process of really trying to have a more participation and more transparency in the decision-making process. So this is an example for our discussion, and thanks very much for your attention.